Welcome back. Well, we've taken care of your baby teeth, but now those permanent teeth have come in, and what do you do with them? Dr. Sheri Margolian is back of Margolian Dentistry, and we're going to talk all about those permanent teeth and how to care for them. A lot of us think we know how to care for our teeth, but I dare say most parents are a little bit lazy when it comes to that daily care for our teeth. So you're going to kind of walk us through how to care for our children's teeth once those permanent ones come through. In our last segment, you mentioned that teeth start falling out somewhere around age 5 or 6.
Yeah, so the first adult teeth to come in are actually not replacing any baby teeth. They're our first adult molars. So they'll come in behind the last baby tooth. So that's the first one you're coming in.
I had no idea.
Yeah, so you'll start getting some teething pain in the back there. And
what
often,
age do those come in?
6 years old. There are 6-year-old molars, yeah. And then they'll start in the front and going back one by one. And between the age of 6 to 13, by 13 you should have all of your adult teeth in.
Okay, so I have a son who is going to be 6 in about 2 weeks, and he is desperate for a tooth to come out, and nothing is coming out, but I can tell him safely, it's okay, because you're going to get those molars, and those are going to be brand new teeth. He'll be happy with that.
Yeah, so
I
no baby tooth lost at that point, but then you'll start losing the bottom front teeth. Those are the next to come.
Those are usually the first ones to go out.
And a common thing we get is parents of 6-year-olds come in, and they're really concerned because their kids have 2 rows of teeth on the bottom. A lot of parents go, what's going on? And what happens actually is those bottom front teeth, they erupt. They come in behind the baby teeth, not directly below. So the period of time where you'll have both sets of teeth in, and it looks a bit weird, but it's nothing to be worried about. We get a lot of parents question us about that, but it'll fall out when it's ready, those baby teeth.
Okay, so once, we've got some baby teeth out and we've got some grown-up teeth in, and don't they start looking like they look like grown-ups when they start getting those big teeth in, but once those teeth are in, how do we care for them?
So we want to watch how they're coming in. First of all, make sure they're all erupting at the right time. So as you come in for your visits, we'll make sure you have the right teeth for your age. And then as spaces start to close up, you want to make sure that everything's aligned properly, no need for braces, and then really getting on top of that flossing, like I mentioned before, because as things tighten up, that's when you can't get away with just the brushing anymore. You got to get in there with the floss.
Do we need to be more worried about the toothpaste and all of that at this point too?
So you don't have to worry about swallowing it anymore. The worry about swallowing the toothpaste is while they're forming. So at that point, all your teeth are formed, all your adult teeth are in. So at that point, you just want to make sure you're using a good amount, and again, brushing for 2 minutes and keeping it all clean. And of course, coming for every 6-month cleaning still to keep everything nice and healthy.
So before the tooth comes in, when they just have those big spaces, which are so cute, but when they have those, how are we caring for those spaces?
So you still want to brush along the gums. If things are tender because the teeth are coming in, then you take it a little bit easy. But once they come through, the relief will be there, and you do brush. Even when they're just peeking through, you want to keep them clean.
Okay, so
brush along there.
What about mouthwash? Because I know my kids watch my husband use mouthwash. They love the idea of, spitting it out, really. Let's face it, that's what they love. But do kids need mouthwash?
It's not a bad idea. It can't replace the brushing and flossing. Okay. But as long as they're rinsing and spitting, and again, not swallowing it, then it's a good thing to add on.
We've talked about this a little bit, about the swallowing toothpaste. When they still have their baby teeth, why do we not want them to swallow toothpaste?
So what happens is the fluoride can actually get embedded in the forming adult teeth. And when they erupt into the mouth, they may look a bit chalky white, a little bit mottled appearance. And that's because the fluoride has gotten into it a little too early while they're still forming, because while they have their baby teeth, the adult teeth are growing underneath. So that's why you don't want to have too much fluoride.
Is there anything you can do once they come up if they have that appearance?
Unfortunately, if they come in looking like that, the only replacement would be a veneer, something like that. Aesthetically, they still function fine. They're healthy. They just have a little bit of an appearance to them, a bit chalky.
Okay, so we want to make sure then that we're taking care of them and not swallowing that toothpaste when they're young.
Yes.
Good to know, man. So now that they have all their adult teeth, they are flossing. Hopefully, I'm very lazy about flossing, but they're flossing. They're brushing their teeth at least twice a day?
Yes.
Okay, and maybe using mouthwash. Is there anything else that they need to be doing to really ensure that they have a good mouth health?
Yeah. So you want to also, at home, just keep an eye out for early signs of cavities. So we traditionally think if you have a dark black hole in your mouth, you have a cavity. But there are a lot of things that can tell you sooner. For one, the health of your gums. If they're red or puffy, that's a sign that you have a little too much bacteria around there, and that can eventually go to your teeth. Another is you may start losing that glossy appearance to their teeth. They become a little dull, chalky, and that's an early cavity. It's still reversible at that phase. You can correct it with coming to the dentist and having fluoride applied to the tooth, better oral health. But if it's gone too far, that's when you start getting holes. So catching it early is a good sign to keep an eye out for your kids.
Be preventative. You're awesome. Thank you so much, Dr.
No
Margolian.
problem.
I've learned so much just for myself, and I know you guys did too. We have to take another break, but we're going to be back just in a few minutes. So you guys stay tuned. More daytime to come.